Hello again, this is Dr. J.C. Smith at Smith Spinal Care Center in wonderful Warner Robins, Georgia. Today I'd like to talk to you about how do you stabilize and maintain a healthy spine. In my 42 years of working here, I've come to a few conclusions. Basically, Americans and most people around the country, the world, are really clueless as to what is a back problem and how do you fix it. Because you have all these different experts giving you whether it's a pulled muscle, slip disc, a subluxation, whatever, and there's over a smorgasbord of over 100 different treatments that are out there now. So it does get confusing as to what do you do. And even in my life, I've had 4 serious back attacks. And I got 4 different explanations from the 4 different doctors I went to. The first guy was a team doctor when I was playing football at the University of California at Berkeley, and he wanted to jump in and do surgery. Luckily, my roommate, who was an Olympic long jumper, he said, forget about that, go see the chiropractor who was taking care of the Oakland Raiders football team. And I did. I went to see Dr. Frank Young, who was a former football lineman himself. He's as big as that door. And he walked in, didn't tell me a word. He just came in and adjusted my mid-back and turned around and left. Didn't even say hello or goodbye. But it got me on the road to recovery. I remember I went back to practice, and the team doctor came up to me and said, well, I guess those pain pills and muscle relaxers I gave you worked, huh? You're back here practicing. I said, no, they just got me high and got me constipated. I said, no, I went to a chiropractor. Oh, little did I know about the medical war with chiropractors. And he just went ballistic. He says, well, you shouldn't have done that. Chiropractic doesn't work. And I said, well, how can you say that? I'm back here practicing, aren't I? Well, that was my introduction to the medical animosity, and that's what I later wrote a book about, the medical war against chiropractors. But since then, now as a practitioner, I really have learned that people just don't know what's going on. I mean, what is a slip disc? What is a pulled muscle? What's a subluxation? What are all these labels that different types of doctors put on the same condition? So today I want to talk about, with my patients, we have 2 goals. The first is to control the pain. Now in the average case, which is 90% what we see, in 2 to 4 weeks, the guidelines say you should be 50 to 99% better. And I find that to be true. The second goal, though, is to stabilize your spine. Otherwise, you could just sneeze and throw out your back and wonder why. And they actually did research on this, finding that most back problems we see are old. They're not new at all. The pain may be new, but 3/5 of adult problems actually begin in the youth, when kids fall off bicycles and roller skates, play football, basketball for girls, gymnastics, cheerleading are killers. So what happens, the kid falls and wrenches their back. But kids heal quick. Pain stops and mom thinks, oh, she's okay. But then 10, 20, 40 years later, they come to see me and they tell me, but all I did was sneeze. And then we'll take an x-ray, find these horrible misalignments, and find this kind of degeneration in the spine, which means that's been going on for decades. That's not a new injury. And they wonder, well, what did I do? They asked me. I said, I don't know what you did, but you did something a long time ago. And usually it's something as ubiquitous as falling off a bicycle. Who hasn't done that, right? You jar your back. Roller skates, I did a lot of that when I was young, let alone football. So there's a million and one ways that people misalign their spines. But if they go uncorrected is when you start getting the bad degeneration that leads to bad disc, bad pinched nerves, but more so, it's a joint problem. This is the paradigm shift that Americans need to take. Most back pain has nothing to do with pulled muscles and slip discs. If I were to send that diagnosis in, it would be rejected and they would laugh and send it back to me. Most back pain is considered biomechanical problems. Because again, your spine is a weight-bearing column, right? It's not a single bone, 24 little vertebrae interconnected by 23 discs and a lot of joints. That's the big thing. Most back pain is generated from dysfunctional joints. In chiropractic, we call it vertebral, meaning vertebra, subluxation, which is the misalignment of these joints. And then you add that with compression. That's the big thing now, since everybody's sitting. You compress your spine all day long. They did research in the 60s where they inserted a needle into the patient's disc. These were students, and they meant not to inject a medicine like a painkiller, but to put a pressure sensor in. And they took standing as 100%. actually, when you go to sit, as innocuous as that may be, it goes to 140%. So sitting is not easy on your back. And then if you bend over straight-legged as opposed to bending your knees, it goes even higher. And then if you're picking up a load, that can put you over 200 pounds. So it's easy enough to blow out a disc just because you've lifted wrong. Plus, when you have a misalignment, imagine if your leg, instead of being straight, what if you ripped your knee and you had a kink in your knee? You couldn't walk on it, first of all, because the joints are misaligned. And second of all, if you let it go uncorrected, it's going to quickly degenerate. And the same with your spine. When you have these misalignments, instead of being straight, you actually put more pressure at the side of the misalignments. And that's where you're going to have your back attack. And if you don't stabilize it, that's where you're going to have your relapse. So the big thing when we examine people, we want to not only do the standard orthopedic neurological tests to find out where the pain is and how bad is it and how well do you move and not move, but more so we take spinal x-rays not to just look for patho-anatomical problems like bone spurs and bad discs and stuff like that, fractures. Everybody's got that to some degree. But we look to the patho-anatomical, pathophysiological, which means how does your spine function? That's the key. And that gets back to the 4 principles that I teach. First of all, you want a spine that hopefully properly aligned, which on the front view is straight, right, with a level pelvis. On the side view, you want to have those nice weight-bearing curves, like we see here in these pictures. Here's the side view and here's the front view. So that's the first main principle. The second is alignment is strength. There's 4 layers of muscles around your spine. And when you injure your back enough to misalign the spine, you're also going to probably be straining the muscles. Or you can even tear them in the worst case scenario. And plus, as you gracefully age, if you don't maintain muscle tone along your spinal column, and you sit, your spine is just basically degenerating. And you're going, it'll take less of a force to have a relapse. The third point is flexibility. Again, research is showing that there's 137 major synovial joints in the spine. You can see the joints here. What's interesting is these joints, if you notice them, these are gliding joints, like my fingers depict. These are not weight-bearing. Our weight-bearing joints, like in your hip, ball and socket, that bears weight. These joints are gliding. They just allow a little flexion, a little rotation, lateral flex, but they don't bear weight. The point is, in the animal world, most vertebrate animals, their spines are beams, right? Horses and dogs and cats, and they walk around on all fours, so their spine's a beam. And again, weight may hang from it, but it doesn't bear the weight. But when we decided to evolve with human beings, and you stood upright, suddenly these these gliding joints, when you stood upright, became weight-bearing. So we weren't designed to stand upright, basically. When I get to the pearly gates, that's the first question I'm going to ask the Lord is, why did you do that? Because it made for a lot of back attacks. So the point of an adjustment is to restore joint motion. I've seen people with perfectly straight spines. So as a weight-bearing unit, say, oh, they're in good shape. But they're all jammed together. And that's what, again, you get from prolonged sitting, especially in chairs. Chairs are notoriously hard on your back. Unless you have these nice computer chairs, they're an improvement. But nonetheless, so alignment, strength, flexibility, and the 4th issue is compression. Again, your spine is a weight-bearing unit. We're always fighting gravity pulling down on us. And then if you're a few pounds overweight, that's going to increase the compression on your low back. And I have, half my patients are overweight. Americans have become a fat society, a lot of obesity. And imagine if you had a normal sized person with a normal size, healthy spine, and then what if you put a 50-pound bag of dog food on your shoulders? How long walking around like that, how good would you feel? Not too good, right? For too long. Well, that's when people are overweight, they have that. That's just 50 pounds. What if they're 100 pounds overweight? And we see those. That is a problem. You could have the strongest, straightest, prettiest spine in the world, but if you're overweight, it's going to be a factor on just the weight-bearing aspect of your spine. So all of our equipment here, whether it's the DRX, decompression, the intrasegmental traction, the Cox distraction tables, even the old spinalator, which many of you have been on, they're commonplace in our profession, great device. I get on every day myself. But they're all designed to restore joint play. Joints are supposed to move, right? They call it joint play. when they stop moving, stop playing, they're locked together, that's when you get the stiffness, the soreness, and the pain. As they say down south, that's when you're all stove up, stiff and sore. So everything that we do here is to restore these 4 principles in patients. But again, the research now, they're pretty clear about this. It's not just the chiropractor doing the job. You've got to do your job. Just like if you're a football player with a ripped knee, it's one thing for the surgeon to rail on your knee and tack up the cartilage and ligaments and all. But then the athlete goes into rehab for what, 4 to 6 months or longer to stabilize it. And that's the thing. If you don't stabilize it, you can feel good for a while. Then you're going to relapse and wonder why. And that's why we give home exercises to every patient. I do them myself every morning. And we also encourage them to go by the ab lounge, ab doer, inversion tables. Everyone knows of these. And they work. I'm on my 5th ab lounge now. I've worn it out. They work. It's just like your jogging shoes. If you get them, wear them out. Don't just sit around looking good. And that's how you're going to maintain your spine. Otherwise, as I say to patients, you're going to be the prodigal patient who I say from back attack to back attack to back attack. When they come in, I say, well, where you been for maintenance care? Well, I was feeling good. And I go, well, that's great. I mean, you still brush your teeth even though they don't hurt, right? See, people are convinced about maintenance dental care. No one wants to get drilled by the dentist, right? Well, you need to take the same attitude. I call take the dental attitude towards your spine. If you start actually doing daily home exercises, a simple squat, stretches, let alone those pieces of equipment I mentioned, it will do wonders to help you offset more back attacks. But if you don't, we'll go from back attack to back attack to back attack, which is like going from toothache to toothache to toothache. And so I tell people, I said, what's more important, maintaining your teeth or maintaining your spine? And for some, they have to stop and think about it. I said, now wait a second. You can live without good teeth. You can get dentures. But you can't live without a good spine. Because spinal back pain is the #1 disabling condition in the world now. It used to be just the workplace, then the military, American society, but now it's globally. Because again, there's been a lot of widespread misconceptions, as the research is called. Back attacks are not caused just by pulled muscles and slip discs. In other words, why would a disc, here's a herniated disc, in this model, the red bulge there, why would it even bulge? A disc is not a muscle, it doesn't move. Think of a disc as a big sponge. It's cartilage, it's fiber, but mostly water. And what they find is when you misalign the spine, mechanically it's going to bulge one way or the other. And then if you're not drinking enough water, like 30 or 40 ounces a day, or if you're drinking things that dehydrate you, like coffees, Cokes, and alcohol, these discs, now because they're overwhelmed with more pressure from the misalignment, and then they're going to start to dehydrate. And they say, oh, you got a bad disc, you need surgery. No, the surgery doesn't realign you and take pressure off. They just fuse you in a misaligned position. What good is that? You may get temporary pressure off that nerve, but it's just going to go to the next level and say, oh, we got to do another. It's amazing how many surgeries people have done before they finally just stop because they don't work. Unless you have cancer, fractures, infections, the red flags. But most people don't. 90% of people have mechanical problems, biomechanical, and that's what we have to work on. And the sooner you understand that and accept it, there's more to back care than just going in and letting the chiropractor adjust you once in a while. That's like only going to a dentist after you have a sore tooth. So I want you to take a dental attitude towards your spine, and all these exercises are quite available. Come in here, we'll give you a whole set of them. But the main thing is get your spine checked by a competent chiropractor to find out where your subluxations are. How badly misaligned are you? How badly degenerated is your spine? There's a lot to stabilizing a spine that you need to know about, because if you don't, you'll be part of that disability group, and that's no fun. Nonetheless, if you have any questions, phone my office. Otherwise, thanks for watching, and I'll talk to you again later.